Hi, my name is Carolyn Henderson. I'm the Clinical Program Specialist for Geriatrics at Owensboro Health. Today, I'm honored to meet with community committee members from the Geriatric Patient Family Advisory Council at Owensboro Health. The goal of our committee is to assure the best care for every older adult who visits the Owensboro Health System. This team has made so many positive changes that have helped improve our care to older adults. May is Older Adult Month, and June 6th is What Matters Day. This is a great time for us to talk about the 4 M's framework of care. The 4 M's are what matters, medications, mentation, and mobility. Today we're going to focus on what matters. Did you know that 2024 was the first year that there were more people 65 years old and older than there were babies born? The baby boomers have arrived. Healthcare research shows that the more consistent care older adults receive, the better outcomes they have. This is how the 4 M's framework of care was developed. The researchers discovered that if care of older adults was planned around what was most important to the older adult patient, the patient had better outcomes. More of them were able to go back home than to go to a nursing home. And more of them had joy in living because what they wanted most was the driver of their care. When you come to the hospital or you go to your doctor's office, your caregiver may ask you what matters most to you, and this may be some of the things they say. So what brings you joy when you're at home? What do you like to do at home? What is something that gets you going in the mornings? Like for me, a cup of coffee, listening to the birds. I love that. What are your goals for your health during a hospital stay and for your overall quality of life? And what is an ideal recovery for you? Hopefully today, after you see this video, you will start to think about what matters most to you and be prepared when your caregiver asks you this. Would any of you like to share today with some of your personal experiences about what matters most?
Well, you know, Carolyn, I can identify with that cup of coffee. I have to have that cup of coffee every morning. And it's even better when I'm at the farm because I hear the rooster crowing.
That's fabulous.
Yeah. Mobility is probably my biggest concern here. About 3 years ago, I had a stroke. It affected my left side, my arm, and my leg, and even my voice box. I didn't know at the time that it affected my voice till several days later, and I'd gotten home. And when I went to church, I couldn't sing. I opened my mouth, there was absolutely no sound. But they determined that I had a weak muscle there too. But the mobility, the quicker you work on it, the better you are. And I'd like to say that this unit here is wonderful, just simply wonderful. It was so vital to me to be functioning ambulatory-wise because I still work. I work full-time, and I'm still to this day working.
Well, I've had the good fortune to not have any major health issues, since retirement. So the things I'd like to keep doing is just taking care of my home and my garden and my yard. I like to travel, and not only in this country but internationally, and that's
Wonderful.
That has been I've noticed it's been more challenging in the last, let's say, 5 years or so. Before COVID, I traveled internationally, and then about 4 years later, I made a trip, and I could tell it was so much harder. You mentioned mobility. You really have to have good mobility to take on the stairs and the different street conditions and going through the airports and that sort of thing. I just want to continue to travel internationally, and I feel like my primary care doctor, needs to be aware of that.
Yes.
So they can give me tips on how to continue to do that.
Sure.
Yes, with my experience being in-care patient, I think the most important thing is communication between your nurse team and actually your doctors that come in every day, and sharing that information with each other, and have some type of plan of care when you're actually discharged, so you're able to function once you get home. So it may be that you may have home health care come in and make sure that that process of moving forward to be able to do it on your own. I think that's very important, that works, the communication between the healthcare provider that's in the office and the provider that comes here to the hospital that's inpatient representing you.
I agree with Mr. Bell. I think communication is one of the most important things in patient care.
That's why it's so important that everybody who cares for you knows what matters most to you. That care plan should revolve around what's most important to you. Thank you all for joining me today and talking about what matters most to you and sharing about what brings you joy. I appreciate it. I'm hoping our audience will think about what matters most to you and be prepared when you go see your primary care person or when you're in the hospital to share with your care team, this is what matters most to me, so they can develop the plan of care for you that day around what is most important to you. The research has proven that you'll have a better outcome if you do that.